Okay, just a little bit uncomfortable, just getting into position.
Oh, yeah.
Try and relax the face up. That's it, perfect. Okay, that's done.
Yeah.
Okay.
Let me down.
After 3, nice deep breath in. 1, 2, 3. That's perfect. Okay.
I've seen on the website people getting this CRF done.
Yeah.
And they kind of feeling good about it. So I thought, I got to try that.
Okay.
Because when I went to doctor, they said to me, oh, we're going to send you to a proper specialist.
Mm-hmm.
They've seen it as well, and they say to me, oh, we're going to like cut, cut a part of your inside of your nose wall.
Yeah.
You might bleed, you might get infection. I said, what happens if I get infection?
Mm-hmm.
They said, you have to come back everywhere to cut a bit more off. I said, if I get a bit more infections, I have no nose less. So I don't want to go down the line yet, because the appointment hasn't come yet. It takes ages to come.
Yeah.
So in that time, I thought, let me try something else.
Yeah, that's always a good approach. Whenever you, I think sometimes we get people who come here and they think, oh, I have to either try alternative medicine or I need to do conventional medicine. But sometimes because there's such a long waiting list, people are just sitting there waiting and nothing's happening. Yeah. So in that time, obviously it's a good idea to try all the alternative things. And then obviously if they don't help you, then you still have that appointment for what the NHS have got lined up for you, whatever. But
that's a long wait.
But it's a good, a lot of people are doing that now. For me,
it was like, I don't go under the knife, That's why let me try this.
Yeah. And as well, as a principle, obviously, it's better to try everything which is, less invasive and safer before you go for something risky like that. Okay, Aludin, let's get a little bit more detail on what you're experiencing then. So you're feeling restriction in your breathing. That's basically what you're...
basically like it's a blockage, left to right. This switches over.
Okay, and if you were to say out of 100% would be completely blocked and 0% would be completely free, how would you feel in terms of...
When it's blocked, it's 100% blocked right now.
Completely.
When it switches over, then the other side is fully blocked. Like right now it's blocked, I can't. This side is open.
Okay.
It's 100% blocked.
And has there been any time where you found that it's been unblocked? Both sides?
The only time when I sprayed. If I sprayed this now, 2 puffs here, 2 puffs here, then it's like as if nothing happened. It's like both will stay open for 10 hours. After 10 hours, it slowly graduates again, starts again.
Yeah.
Well, when I spray this, it's as if nothing's happened. I'm back to normal.
Yeah. So this is obviously, this is a steroid spray.
Yeah.
Okay, so obviously...
Maybe, flattens the inside nerves or something.
So in the long term, this will damage the nasal linings and it's going to make them weaker. Yeah. So it's not a good thing to use long term. Definitely need to find another type of solution to this. So you said this started 5 years ago.
5 years ago, after the
post shoulder op, and you said they put things down the nose.
Yeah, oxygen pipes.
Okay. And was there any bleeding or anything after that? Do you know?
Not really bleeding, but I felt sore. Like my nose was like sore, maybe because the pipes were in there. But I was kind of part awake when they yanked them out. Yeah. I think in quite speed, I was like, oh, so I felt like they scraped it.
Yeah.
I did tell them they got a report there as well. But they said, oh, no, okay, better go to your doctors, get some nose drops and this and that. And, they gave me some nose drops at the beginning, but it wasn't really working or nothing.
Okay.
But once I tried this, that was like as if nothing happened.
Okay. And what do you know about the craniofacial release technique so far? What do you know about it or understand about it?
Well, from what I've seen on the website is that they put the balloon up there, pump it up, and it kind of opens it up, the vessels inside.
Yes.
Breathe better.
Yes.
But it kind of stretches the wall from inside.
Yeah.
Also, by doing that, maybe if it gets heated in the room, if there is a bit of swelling, it will still pass. Yeah. Actually still breathe hopefully better.
Yeah. So in your case, so quite often you have what we call kind of like a physical restriction, or what we call an occlusion. You get something which is blocking the airway, and the balloon can help open and kind of expand it. In your case, you're having inflammation, right? And it seems like it's recurring. You're having this recurrent inflammation. Yeah. So we're gonna, we can definitely give this a go. We've had patients who have similar issues, and alhamdulillah, we've had some successful cases in that. But with yours, because it's an inflammation, in the process of trying to open this up, it may cause a little bit of inflammation as well. Okay, so I want you to know that sometimes after this you might feel a little bit bunged up, but what we're going to be doing is we're just going to be stretching the whole area anyway to maximize that breathing capacity for you.
That's what.
So it may be that there may be a slight restriction in the breathing passages, and then the inflammation completely closes that up. So if we're able to open that up a little bit, and even if it does get inflamed, that should still leave a bit of room for you to be able to breathe properly.
The only thing I don't understand is why does it switch over? And right now this is blocked. So give it about 4 or 5 hours, this will get blocked and this will open up. So I don't know why it's switching over.
Yeah, I think maybe potentially due to pressure changes. Have you ever felt any pressure in your sinuses around here or here?
No, nothing. I don't feel no pain around here.
Okay, so just to explain how the process works, okay, so we're going to use a small balloon, or I'll use a small stick to actually guide the balloon in position. So you've watched a few videos, so you've seen how it works, okay. So yeah, we'll just get that in position. That's a little bit uncomfortable when that happens. And as quickly as we can, what we'll do is we'll then inflate the balloon at that point. The balloon is only inflated for a very, very short period of time, and then it reduces back down and we take the balloon out. Main thing is just to try and keep your hands down. Sometimes the natural thing will be to put your hands up, okay? And the good thing is, like you said, when you're asleep, you don't know what's happening to your body, right? So like in your case, we've had the pipes and everything, you don't have that kind of feedback or control. In this situation, it is uncomfortable, but you're awake. Okay, so there's nothing going to happen to your body that you're... Okay, so you ready to get started?
I'm ready.
Okay. Now, before we do the ballooning, we're going to do some chiropractic work for you. Okay, because the key is that this doesn't just work on your breathing passages, it also works on your nervous system. Because right behind where we're ballooning is actually where the bottom of your brain sits, and we're going to be expanding the space there, which will have an effect on what we call your cerebrospinal fluid, which is a good, positive effect, that it helps kind of stimulate your nervous system in a really positive way. Okay, so let's get you laying down onto your back. We're going to start with a little bit of chiropractic adjustments, and then we'll get going with the ballooning. Okay, so we're just going to work into the neck. So I need to relax the head for me as much as you can. Okay, so we're going to give a little push just into here. I want you to let everything nice and loose into my hands. Nice and relaxed, little push. Good. All right, again, everything nice and relaxed. Rest the head into my hand. Good, and just a little push here. Perfect. All right.
That's good.
All right, good. Okay,
relax.
Good. Okay, let's get you laying on your tummy now. Okay, I'm just going to pop this just here. And we're just going to give a little bit of a push just into here, okay? Let everything loose into my hands. Okay, and again, a little push here. Okay, and resting straight down. I'm going to give a little pressure into your mid-back now. Deep breath in and all the way out. Good. Excellent. All right, and now let's get you laying on your side for me. Facing me. Good. We're just going to bring the shoulders around here and here, holding the elbows. We're going to bend the top leg just to here. I'm going to give a little push into the lower back, okay? Again, everything loose. Okay, and now on the opposite side. Good. Okay, we're going to bring the shoulder around here, holding the elbows here and here, bending the top leg and leaning back. Okay, and again, a little push here. Okay, perfect. All right, now let's get you laying onto your back, and we're going to get started with the ballooning side of things. So we use just a little bit of lubrication around on the balloon, so it'll feel a little bit wet. What we're using.
It's the right one which is blocked at the moment.
Okay, if the right one's blocked, we're going to start on the left side. Okay, so I'm just going to bring the bench up a little bit. We're good if I. All right, you okay?
Yeah.
Okay, so I'm going to insert the balloon. It's going to feel a little bit uncomfortable when it gets into position. Once it's in, I'm going to then just use a few small pumps until you feel a little bit of pressure there. And then I'm going to tell you after 3, I want you to just take a breath in and just hold your lips together. And then we're going to inflate the balloon. Once the balloon's inflated, you can release your lips, okay? And then we'll inflate the balloon and we'll take it out as quickly as possible, okay? So resting everything for me, just keep the body nice and relaxed. Try and relax the face as much as you can. Okay, that's perfect. Good. Okay, excellent. That's gone in really well. Okay, I know it's a little bit uncomfortable.
No, it's fine.
Okay, so we're going to put a little pressure in now. So you're going to feel that just seeding and just getting into position.
Yeah.
Okay, you okay?
Yeah.
Okay, and then after 3, we need to take a nice deep breath in and just pucker the lips together. Okay, 1, 2, 3. Perfect. Just. That's it. Okay. All right. Excellent. Okay.
Yes.
You all right?
Yeah.
Okay.
Oh.
Okay. And it was a bit of a shock. Take a breather. Okay.
Yeah.
I think it's a bit of a shock when you can't breathe for a second, yeah?
Yeah.
Okay.
I felt a pop in it.
Yes.
Felt the pop.
Okay.
Oh, wow. Oh, yeah.
Okay. I'll just give you a minute. Okay. And then we'll get it started on the other side.
Yeah.
You okay?
Yeah.
Okay. You ready to go for the other side?
Yeah.
You sure?
1 second.
Okay. No problem.
Yeah.
All right. Okay, Bismillah. Okay, again, resting. Let me do everything for you.
Yeah.
Okay, just a little bit uncomfortable, just getting into position.
Oh, yeah.
Try and relax the face up. That's it. Perfect. Okay, that's done.
Yeah.
Okay.
Let me know.
Okay, so just relax the face now. We need to relax the head. Try and keep everything nice and loose. Okay, because the more you tense up, the more you'll feel the pressure.
Yeah.
So I want you to just try and relax up a little bit. You can feel now as the balloon is just seeding into position. Okay, so here we go. We're going to take, after 3, nice deep breath in. 1, 2, 3. Okay, perfect. Okay, excellent. All right. Okay. You good?
Yeah.
Okay. Okay,
Felt that
perfect.
pop now.
Okay, so I want you to just take a minute, just rest. If you want to sit up, you can sit up. Or if you find where you are, you can just rest as you are. But you've done really well. Okay, there you go, some tissue.
Oh yeah, that felt good.
Okay,
Oh yes, I can breathe better now.
Alhamdulillah. You felt it straight away, yeah?
Yeah.
Good.
It was like instant release. I felt the, the breathing just kicked in.
Alhamdulillah. Good. Okay, and you haven't used any of the nasal sprays today at all, no?
No, I did it last night as well.
Good. Okay. All right. When you're ready, let's get you sitting up. Okay. All right. Alhamdulillah. We've got through that. I'll give you a little bit of tissue. Okay. So in the next 24 to 48 hours, you might feel a little bit of kind of release as well, some kind of mucus and stuff coming through, which is not unusual. Okay. Just keep clearing it. There's 2 things that I want you to do. Okay, the first one is I want you to just sniff water into the nose, okay, and then blow it out. It's just like when we make wudu, when we put the water in our nose, I want you to do the same thing, okay? I want you to just keep repeating that, and if you can do that as much as you can, so 4 to 5 times a day would be kind of a minimum, but I want you to just keep clearing it and then blowing it out, okay? Now, a second thing I want you to do is an exercise, okay? In which you're going to hold one nostril, okay, and you're going to hold it closed, and what you're going to do is you're going to force air in like that, and then you're going to breathe out very fast like that, yeah, and breathe out hard and fast, okay, and I want you to repeat that. I want you to repeat that for a cycle where you do it 50 times, okay, so And you really need to suck in from your tummy and blow out. Yeah? Perfect. And you just do it nice and fast as well, okay? I want you to just keep repeating that. You can do it in a set of 10 where you do it 10 times and then like you don't have to do 50 in one go. When you do this, you might feel a little bit lightheaded. Okay, it's very normal for that to happen. But I just want you to just keep doing it as long as you can, as fast as you can, and just keep that going and then switch to the other side. Okay, if you want to do 10 on one side and then 10 on the other, that's completely fine. But you need to do that at least once a day. Okay, this is going to this is going to help kind of open up the passages and yeah, and when you do it, okay, when you do it at home, what needs to happen, if you do it, especially if you're on your own, is the best time, because when you do this, there might be a lot of mucus and a lot of stuff that actually comes out of your nose, okay? So you do it very forcefully, even if there's snot that comes out, just keep breathing through that cycle and just keep. I want you to do that, but as hard as you can, nice strong pressure. Right. Okay. What I'm going to do is we'll get you scheduled in the diary as soon as we can, the next available appointment. I think we'll leave a little gap, okay, in between now and when we see you next. And then we're going to repeat the same process, but next time we're going to be doing a couple of balloonings on each side. The good news is that once you've had the first session done, the opening up, the second session actually feels a little bit easier, okay, because it's opened up a little bit. Also, you kind of know what to expect a little bit. So how did you find the whole experience?
Much better. I felt like, I just felt the air like going up my nose better than before, I felt the air in my brain, I felt it's going to my brain, I feel better. I felt a bit more relaxed now.
Yeah.
Yeah, relaxed. But I think I need to do the breathing thing.
So you felt kind of
better than before.
You felt an instant change.
Yeah, I felt a pop in both. When you did it the second time on the right, then I felt the pop.
Yeah.
The first one, it was okay, but the second one popped it.
Yeah.
So that I think something's opened up inside.
Yeah.
So I feel better, But I just want to know now, will it really switch over?
Yeah.
After a few hours, I'll know automatically. If it doesn't switch over, that'll be okay. If it switches over, then
it takes time as well. So obviously it's been 5 years that you've had it since you had the surgery and since you've had the complications with it. So it will take a little bit of time. So, it's great to feel a change in your breathing straight away. That's not always the case. Not everyone feels that immediately. The fact that you're feeling that is a really good sign.
Feeling good. I felt like extra oxygen going up my nose now.
Yeah.
So even tonight I won't use those nasal
sprays.
Yeah,
I would advise you to try and avoid using them at all costs, okay? Because long term, using steroid sprays in your nose all the time, and you've been using that for how many years now?
Nearly 5 years.
5 years, yeah. It's not good for your system overall. Long term use, it's not getting any better, is it, doing that?
Yeah, it just gives you, for 10 hours, I feel as if my nose has opened up, but but I can't survive on that all the time.
100%.
But I feel much better now. It's, I feel like something's opened up inside. I feel it,
Good. Alhamdulillah, really good. Really happy that you've come and started this process.
Yeah.
Inshallah.
The next one, I'll book the next one in.
Yes.